Good day everyone, I am Risha Etelberondo and I will report the first part of the Hashimoto's disease. Before I begin my discussion, let me just give you a short information about the contents of my report. First, I will discuss the introduction of the disease and what is it all about. The next is the etiology or the cause of the disease, then its risk factors, and lastly is the clinical manifestations. For the introduction, what is Hashimoto's disease? Hashimoto's disease is an autoimmune disorder affecting the thyroid gland. Sinabi nating autoimmune disorder, it is an illness caused by autoimmune system attacking healthy tissues. So thyroid is a butterfly-shaped gland that is located at the base of our neck just below the Adam's apple. The thyroid hormone or the thyroid produces hormones that helps regulate many functions in the body. And one of the main functions of these hormones is that they regulate metabolism. So pag sinabi nating metabolism, this is the process in which how your body turns food into energy. So without enough energy, our body cannot operate normally and its functions begin to slow down. So in Hashimoto's disease, the immune system cells leads to the death of the thyroid's hormone-producing cells. The disease usually results in a decline in hormone production, which is called hypothyroidism. So, our immune system, gumagawa sila ng antibodies that attacks the thyroid gland. So, in result, this damages our thyroid gland, so it does not make enough thyroid hormone. So, ito na siya yung tinatawag natin na hypothyroidism. And hypothyroidism, pag lumala, this can cause our metabolism or the function of our metabolism to slow down, which can lead to symptoms like weight gain, fatigue, and other symptoms. And also, for further information, Hashimoto's disease is named after the Japanese surgeon who discovered it in the year 1912. So, Hashimoto's disease is also known as Hashimoto's thyroiditis, chronic lymphocytic thyroiditis, and chronic autoimmune thyroiditis. The next is the etiology or the causes of Hashimoto's disease. Hashimoto's disease is an autoimmune disorder. So the immune system creates antibodies that attack thyroid cells as if they were bacteria, viruses, or some other foreign bodies. The immune system wrongly enlists disease-fighting agents that damage cells that can lead to cell death. So what causes the immune system to attack the thyroid cells is really not clear, but the onset of disease may be related to these following etiologies. So first, we have the family history or genetic factors. Hashimoto's disease may run in families. The next is the environmental triggers such as infection, stress, or radiation exposure. And lastly is when a mother recently had a baby. So although anyone can develop Hashimoto's disease, it's most common among middle-aged women than in men. So the primary treatment of this is thyroid hormone replacement. So some women have a thyroid problems after having a baby, which is called the postpartum thyroiditis. So itong postpartum thyroiditis, the thyroid often returns to normal within 12 to 18 months after the symptoms start. But if you have a history of postpartum thyroiditis, the risk is higher for developing this permanent hypothyroidism. So next is the risk factors. So what are the risk factors of Hashimoto's disease? So these are the following factors that are associated with an increased risk of Hashimoto's disease. First, we have sex. Women are much more likely to get the Hashimoto's disease, as what I have mentioned earlier. It is most common in middle-aged women than in men. Next is the age, which is in Hashimoto's disease, this can occur at any age but more commonly occurs during middle age. Yun nga, sabi ko kanina. And then, Next, we have the other autoimmune diseases. So having another autoimmune disease such as rheumatoid arthritis, type 1 diabetes, or lupus increases the risk of developing Hashimoto's disease. The next is the genetics and family history. So you're at higher risk for Hashimoto's disease if your family have a history of thyroid disorders or other autoimmune diseases. Then, as what I have mentioned in earlier, kanina sa causes, is the pregnancy or if the mother recently had a baby. So typical changes in immune function during pregnancy may be a factor in Hashimoto's disease that begins after pregnancy. So yun yung tinatawag natin na postpartum thyroiditis. So excessive iodine or iodine intake. So too much iodine in the diet may function as a trigger among people already at risk for Hashimoto's disease. Then lastly, for the risk factors, we have the radiation exposure. People exposed to excessive levels of environmental radiation are more prone to Hashimoto's disease. Then for the last part of my report is the clinical manifestations or the signs and symptoms of Hashimoto's disease. Okay, so some people may not have any symptoms at first, but Hashimoto's disease is a disease that progresses slowly over the years. So as the disease slowly progresses, the thyroid gland becomes enlarged. So ito na yung tinatawag natin na condition na goiter. So yung goiter, this is a common first sign of Hashimoto's disease. So goiter, this is painless but can create a feeling of fullness in the throat. So it can also make the front of your neck look swollen. So I guess we're all familiar naman with goiter, which is yung lumalaki yung parang sa baba sa leeg na part ng isang tao. So other symptoms of Hashimoto's disease that develop over the time includes the following. So first, we have fatigue and sluggishness, increased sensitivity to cold, increased sleepiness, dry skin, constipation, muscle weakness, muscle aches, tenderness and stiffness, joint pain and stiffness, enlargement of the tongue, irregular or excessive menstrual bleeding, depression, problems with memory or concentration, goiter, puffy face, brittle nails, and hair loss. So that would be all for my part. Thank you.
Hi everyone, my name is Marjana Tomas and I'll be discussing about Hashimoto's disease, the continuation of Hashimoto's disease. So take time to read this. Very good ka kasi pinanood mo ito. Tapusin mo para may plus point ka sa langit and of course sa evaluation later because I'll be giving questions later. Okay, the coverage of this discussion includes pathophysiology, assessment, diagnostic findings, and complications. So now let's begin. Remember these terms and their functions para di ka magka-tension headache while learning. Char. Okay? So first is the thyroid gland. So ang thyroid gland, of course, alam nyo na. We also have the metabolism, mentation, movement as 3 M's or function of our thyroid hormones. You know what mentation is? It is mental activity. So our thyroid hormones helps or contributes to our mentation, to our mental activity. Okay, so we also have the triiodothyronine and thyroxine, T3 and T4. So why does it have number? Why does it have T3, T4? Okay, because that number represent the number of iodine present in that hormone. So T3, there are 3 iodine in triiodothyronine. T4, there are 4 iodine in thyroxine. Okay, so we also have the TRH or thyrotropin releasing hormone and thyroid stimulating hormone. So later I'll be discussing those hormones. And then we also have the thyroglobulin, which is a protein inside or within our thyroid tissues or thyroid cells. And then we also have the thyroid peroxidase or that is we also have the thyroid peroxidase, which is in charge of iodination. So what it does is the thyroid peroxidase is an enzyme. So it binds the thyroglobulin, which is a protein, with the iodine to make what? To make T4. So before we can get T4, we need a thyroglobulin, which consists tyrosine, and also 4 iodine, okay, to make a T4, which is a thyroxine. And then we also have a deiodinases. So those enzymes, 2 enzymes, are in charge of the iodination. So the iodination is breaking away 1 iodine from a T4. So, okay, why do we need to remove 1 iodine from T4? Because we need to make T3. So that T3 is very essential in making ATP for our energy. Okay, review: iodination for combining iodine and thyroglobulin, which consists tyrosine, and then the iodination is removing or breaking apart 1 iodine from T4 to make T3. Okay, now we also have the CD4 T cells, helper T cells, CD8 T cell, killer T cell, and T cell suppressor. So that's very important. I hope you already know that because we've already discussed that from during last semester. Okay, now let's proceed to Hashimoto's disease. So as you can see in the illustration or the picture, the neurotransmitter commands our hypothalamus to create TRH, thyrotropin releasing hormone, and then our TRH, okay, stimulates or tells our anterior pituitary gland to release TSH, or thyroid stimulating hormone. So that thyroid stimulating hormone commands or stimulates the thyroid gland to create T4 and T3. So that's when we can have our T3 and T4, which can be used by our body for multiple purposes. So I hope you already know the purposes of those hormones. This is just a review. Okay, so for the pathophysiology, we have first the risk factors. So what are the risk factors of developing what are the risk factors of Hashimoto's disease? We have Down syndrome, Turner syndrome, stress, HLA-DR3 genes, family history, gender, female is at higher risk of developing this disease, and high iodine consumption, rheumatoid arthritis, Graves' disease, Addison's disease, Sjogren's syndrome, vitiligo, diabetes, radiation exposure, and low vitamin B12. So take time to research about those, how those are related to Hashimoto's disease. So for the disease process, we have first, the defective T cell suppressors. So pag nagkaroon, if there is a malfunction with our T cell suppressor, which is what we consider as someone or some cell in our body, immune cell in the body, that protects our cell, our own cell, from being distracted by the immune cells. So these T cell suppressors, it introduces us to those immune cells to prevent them from mistaking us as foreign particles or foreign cells, foreign materials in our body, because automatically our immune system will react to a foreign material to remove it because it is considered as a threat to our body. So if there's the defective T cell suppressor, of course our T cell suppressors cannot do its function, which is to introduce us to our own immune cells. So as a result, we will be unidentified by our own immune cells, and then it leads to cell-mediated destruction of thyroid follicles. I hope you can understand it. Due to the immune response done by our own immune T cells and B cells and lymphocytes, our own cells will be destructed because it was considered as foreign materials or foreign cells. And then it will lead to B cell mediated production of antibodies against thyroglobulin, thyroid peroxidase, TSH receptor, and sodium iodine symporter. So those mentioned, thyroglobulin is a protein, thyroid peroxidase enzyme, TSH receptor, and then sodium iodine symporter, okay, so which is a protein membrane. So those, if there's a problem with those mentioned, if there's a problem which is nagkaroon ng antibodies against them, okay, so of course may inhibit yung production, may inhibit yung absorption or presence ng mga na-mention na yun, kaya we cannot make thyroid hormones, which is the T4 and T3, because those are important. As what I have mentioned earlier, in order to make T4, we need the thyroglobulin and thyroid peroxidase to combine the thyroglobulin and the iodine for iodine together to make T4. And then we also need the iodinases to break apart one iodine to make T3 for which will help us to create ATP or adenosine triphosphate. So that's this is also the reason why one of the symptoms of the Hashimoto's disease is fatigue, because nagkakaroon ng lack of ATP production, which is what we use for energy. Okay, and then as a result, it will lead to decrease in T3 and T4. So when there's a decrease in the thyroid hormone, we will also lose the negative feedback regulation and anterior pituitary gland and hypothalamus. And then it will eventually lead to increase in TSH and TRH, because that is a compensation. Pag konti yung thyroid hormone, of course, magdodouble yung work ni thyroid stimulating hormone and thyrotropin releasing hormone. Thinking na sila yung may kasalanan kung bakit hindi nagpa-produce si thyroid gland ng hormone. Kaya i-force nila, damihan nila yung hormone na TSH and TRH para ma-force si thyroid gland to produce T4 and T3. But mali-detect pa rin yung T4 and T3, low in T4 and T3, kaya increase pa yung TRH and TSH. However, it will eventually lead to hypothyroidism because there is a progressive decrease in T3 and T4. Kaya if you are asking if hypothyroidism ba ang cause ng Hashimoto's disease, it is the other way around. Hashimoto's disease can cause hypothyroidism. Hashimoto's disease is an autoimmune disorder. So, you can have hypothyroidism, but while pwede kang magkaroon ng hypothyroidism kahit na wala kang Hashimoto disease. Pero, pag may Hashimoto's disease ka, magkakaroon ka ng hypothyroidism. Yun talaga. And, question, is it curable or not? Of course, it is not curable because may problema talaga is yung gland mismo. So, you just have to take supplements, hormonal supplements to regulate the metabolism of the body. So, pero lifetime yung hormonal therapy na yun. Kasi, yung therapy na yun ang magsiserve as nagre-release ng hormone. So, yun na ang provider mo or source of hormones mo ng thyroid hormone. And then, now let's proceed. What will happen if you don't treat Hashimoto's disease? So please watch this video and understand it.
What happens if you don't treat Hashimoto's thyroiditis? You'll end up in end-stage Hashimoto's thyroiditis. Let's talk more about that condition right now. As you know, Hashimoto's thyroiditis is an autoimmune disease of the thyroid gland, which means your own body is attacking and destroying your own thyroid gland. If this goes on for long enough, your body will succeed and it will permanently destroy your thyroid gland. When this happens, your thyroid gland will become atrophic or shrunken and pretty much non-functional. If you get to this point, you will then require thyroid medication for the rest of your life, because even though your thyroid gland is still inside of your body, it's not doing anything. The good news is this process takes a long time, usually around 10 to 20 years or even longer. So that gives you a lot of time as a patient with Hashimoto's to do something about it to try and prevent this process from occurring. Your doctor may take the sit and wait approach and just give you thyroid medication, but that's not all you can do. Hashimoto's thyroiditis versus hypothyroidism. What is the difference? Hashimoto's thyroiditis is the most common cause of hypothyroidism in the United States, and it is considered an autoimmune disease. What that means is your own immune system is attacking your thyroid gland. And in this case, it causes eventually permanent destruction of the thyroid gland. Eventually, that damage to your thyroid gland adds up. And at some point, your thyroid is not able to produce enough thyroid hormone, which causes you to become hypothyroid. Hypothyroidism, on the other hand, is just a state of low thyroid. It means your body is not producing enough thyroid hormone, but it doesn't tell you why. That's why most people who have hypothyroidism do have Hashimoto's, but not every case of hypothyroidism is caused by Hashimoto's thyroiditis. If you have low thyroid function, you should go to your doctor and try to find the root cause.
Now let's proceed to the assessment. So for the assessment, we have inspection and palpation of lower neck region. We will look for, or we will assess for the size of the thyroid gland, the shape, the consistency, the symmetry, the tenderness, and presence of firmness. Because firmness and tenderness can be an indication of Hashimoto's disease, correct? And then we also have the medical family health history taking. So why we need to take this? Because as what I have mentioned earlier, there are risk factors and other contributors that can increase the risk of a person to develop the disease. And then also manifestations. So we need to check the manifestations para malaman natin kung meron ba siyang Hashimoto's disease, like the fatigue, which is a very obvious sign and symptoms, and many more symptoms or signs and symptoms. Then gender, because female is at higher risk of developing this disease. Then we also have the diagnostic findings in high TSH and low T3 and T4. What does that mean? Ano bang indicator yung high TSH and low T3 and T4? Ano bang dinadiagnose natin with that findings? So, of course, kailangan mo yan, makikita mo yan sa serum laboratory, yung mga thyroid test na na-mention din, or na-mention din. Okay, so, pag merong high thyroid stimulating hormone, meaning, yung katawan mo, nagko-compensate para increase niya para i-force niya si thyroid gland to increase its T3 and T4. So, meaning, pag mataas yung TSH, meaning, mababa ang thyroid hormone mo. Kaya nga merong mataas yung TSH kasi sinasabihan niya or ginagawa niya ginagawa niya ng paraan para itaas ni thyroid gland yung thyroid hormone. Pero, mababa pa rin ang thyroid hormone mo. So, pag mataas ang TSH, mababa ang thyroid hormone, kahit na mataas si TSH, pero hindi pa rin tumataas si thyroid hormone, meaning, possible na merong hypothyroidism and possible na malaki ang chance na may Hashimoto's disease. Hashimoto's disease, ito. We also have the high anti-thyroid peroxidase. Yan yung pinaka main na makakapag-point na merong Hashimoto's disease. High anti-thyroid peroxidase and thyroglobulin antibodies. Pag merong thyroglobulin antibodies, meaning, mapaprevent yung binding of thyroglobulin, which is a protein, and the 4-iodine para makagawa ng T4, which is ang thyroxine natin. So, pag na-prevent yun, of course, hindi ka makakagawa ng thyroxine. Parang kang gumagawa ng pancake na wala kang flour, wala kang butter, wala kang milk. So, how can you make a pancake when you don't have the ingredients in making it, diba? Remember that. And then, high anti-thyroid peroxidase din. It is also very clear. Thyroid peroxidase. Ibang thyroid peroxidase is enzyme. Yan yung tumutulong para mag-bind si thyroglobulin at saka si iodine through iodination. Pag merong high anti-thyroid peroxidase, of course, paano magbabind si globulin at saka si thyroid kung wala si thyroid peroxidase? I hope you understand it. Please take time to analyze or to para intindihin. Take time to para maintindihan nyo itong mga discussion na to because it is fun. Okay, for the complications, we have hypercholesterolemia, hypertension, heart disease and heart failure, myxedema link, and death. So, do you know what that myxedema link? So, it is about a body slows down to the point it can threaten life. So, very slow down yung reaction sa katawan natin. Kasi diba, ang thyroid hormone is very important in metabolism in our body. Ay, sinabi ko kanina, 3 M's. Ano yan? Movement, metabolism, and mental activity. So, tingnan mo, pag mababa yung thyroid hormone mo, maapektuhan yung mental activity mo, maapektuhan yung movement mo, maapektuhan yung metabolism mo. So, of course, it can lead to myxedema link. So if left untreated or left unmanaged, yung Hashimoto's disease, it can lead to death. Of course, it is life-threatening. So for the plus points, okay, for the instruction, choose one question from the questions provided below and send me your answer via private message. Good luck. Okay, so just choose one question and answer it. Indicate the number, okay? Okay, so private message me in my account, Marjana Tiala Tomas. That's my messenger account. I'll be waiting for your answers and I'll note those who can answer it. Okay, thank you for watching.
Assalamualaikum and good day to each and everyone. I am Naslaini Kapampangan, and in this video we will talk about the management and treatment for Hashimoto's disease. So the treatment for Hashimoto's disease aims to control the symptoms of the disease. But as we all know that Hashimoto's disease can lead to hypothyroidism. So this is when the thyroid gland is affected and gradually stops producing enough hormones to keep the body working properly. If the thyroid gland is functioning normally, then the patient may not need any treatment, and a healthcare provider generally choose to monitor the condition and watch for any changes of the thyroid health. So this is because the doctor will probably want to monitor the condition if it progresses. So moving on for the medical treatment, if Hashimoto's disease does progress to hypothyroidism, then ang primary objective natin is to manage hypothyroidism and ma-restore natin yung normal metabolic state by replacing hormone. So our usual treatment for that is, first, hormone therapy or pharmacological therapy. So we have here the synthetic levothyroxine or Centroid or Levothroid. So ito yung most preferred preparation for treating hypothyroidism, and it suppresses the non-toxic goiters. So ang dosage sa hormone replacement na ito is magbe-base lang sa patient's TSH concentration. So kailangan nating malaman yung TSH result ng patient if it is low or high. So kapag low yung TSH level ng patient, yung thyroid hormone dose is excessive and kailangan nating mag-reduce. Kapag mataas naman yung TSH level ng patient, then our thyroid hormone dose is very low and should be increased. So malalaman natin kapag ang replacement therapy na to is adequate and effective kapag wala na yung symptoms ng myxedema and normal na yung metabolic activity ng patient natin. And then, prevention of cardiac dysfunction. So, angina and dysrhythmias may occur kapag ang thyroid replacement is initiated because thyroid hormones enhance or naapektuhan niya yung cardiovascular effects of catecholamines. So, itong catecholamines is neurohormones na kapag tumaas yung level is magkukos ng high blood pressure, pounding of heart, pain chest, and anxiety. So, it is very important for the nurse to monitor for myocardial infarction, which may occur in response to therapy ng patient. So, the nurse must also alert for signs of angina, especially during the early phase of treatment. So, kapag ma-detect yung isang symptoms, it must be reported and treated at once to avoid fatal myocardial infarction or any cardiac dysfunction. And then we have supportive therapy. So, included dyan yung pagmamonitor ng oxygen saturation ng isang patient using pulse oximeter. Fluid should be administered cautiously because mag-lead ito sa water intoxication. And then application of external heat must be avoided because it increases oxygen requirement and may lead to vascular collapse. And oral thyroid hormone therapy should be continued. Moving on for the nursing management for patient with hypothyroidism or Hashimoto's disease include promote rest. So it is very important to space activity to promote rest and exercise as tolerated. Second, protect against coldness. So the patient often experience chilling and extreme intolerance to cold. So, we must provide a extra layer of clothing or extra blanket if meron. And then, avoid external heat exposure. So, it is, dinidiscourage natin yung paggamit ng external heat source kasi magkakaroon tayo ng risk sa peripheral vasodilation and further loss sa body heat. And then, mind the temperature. So, very important na ma-monitor natin yung patient's body temperature because this will detect decreased body temperature and onset of eczema coma. And then, increase fluid intake. So, we will encourage increased fluid intake within limits of fluid restriction. So, this promotes passage of soft stool. And then manage respiratory symptoms. So, we want to monitor the respiratory depth, rate pattern, and ABG. So, we will identify patient baseline to monitor further changes and evaluate effectiveness of intervention. And then pulmonary exercise. So, we want to encourage them a deep breathing and coughing exercise or use of sensitive spirometry. And then, orient to present surroundings. So, alam naman natin ang patient na may hypothyroidism has a decreased mental status. So, we want to orient them to time, place, date, and events around the patient. So, moving on for the surgical management. So, we have here the thyroidectomy. So, many patients with Hashimoto disease have thyroid surgery for a number of reasons. So, patients with Hashimoto's can have large or suspicious nodules or tumor in the gland, thyroid cancer, or an enlarged thyroid gland or goiter that required thyroid surgery. And due to scarring and inflammation from Hashimoto's thyroiditis, surgery can be very challenging and riskier. So, the entire thyroid gland must be removed to cure Hashimoto disease, and complete thyroid removal is even riskier than thyroid surgery for half the thyroid. So, if you will ask, do we need to remove thyroid for Hashimoto's disease and hypothyroidism? So, the medical expertise will answer no, and surgery is not necessary because hypothyroidism and Hashimoto disease are managed by medication. So, as I've said, necessary ang surgery kapag uncurable or ineffective na yung hormonal therapy ng patient, or kapag ang patient ay may mga large or suspicious tumors or may mga goiter na kailangan ng tanggalin. So, that will be all for my report. Thank you for listening.